Good afternoon, everyone, and thank you for joining us in this third installment of our webinar series, the Economic Justice Webinar Matters series. So today we'll hear a presentation of a new research that has recently been published by Institute for Economic Justice with support from AFD, the French Development Agency. So this is on, the title of the research is Systematic Exclusion from a South African Social Assistance Transfer. It's on the Social Relief of Distress Grant, which was an emergency cash transfer during the COVID-19 pandemic, during the height of those lockdowns, and which has remained and has gone through several iterations and now is currently targeted at those who earn under the, or with means under the food poverty line. Its lifespan has been characterized by massive levels of exclusion, which have inspired a few court cases and has been the basis of a lot of advocacy, especially for the realization of a basic income grant in South Africa. But despite this, we haven't really seen a lot of systematic investigation into the drivers and causes of exclusion from this grant. That is until, of course, this research. So my name is Siyanda Baduza. I'm a junior researcher in basic income and social protection at the Institute for Economic Justice, and I'll be facilitating the session. I was also one of the contributors to this paper. And joining us, presenter will be lead investigator for this research, Dr. Kelle Howson, who is a senior researcher and project lead in social security and workers' rights at the Institute for Economic Justice. We also have three panelists who will be joining Kelle this afternoon. We have Kgotatso Sibanda from the Black Sash, who's National Helpline Paralegal, Dr. Wiseman Mahasela, founder and executive director of Claremont Analytics, and Dr. Stephen Kidd, CEO and principal policy specialist at Development Pathways. So the way the program is going to be structured is I'm going to be handing over shortly to Kelle, who's going to present the findings of the paper for around 35 minutes. Then we'll go to our panelists, who are each going to offer their reflections. We've kept it pretty open-ended, but their reflections may be connected to their own work for around 10 minutes, and then we will have an open discussion in the last 15 to 20 minutes of the session. But I would like to encourage everyone, if you have any questions, please pop them in the chat at any point during the presentations, even if the open discussion is right at the end. And then last bit of housekeeping is I'll be pasting the links to the paper. So we have the paper, a fact sheet that summarizes the findings of the paper, as well as a short blog post published by Development Pathways on the paper, should you want to read it for yourself. Without any further ado, I'd like to invite Dr. Kelle Howson to present the findings, and I'll hand over to you, Kelle.
Thank you so much, Siyanda. I'll just share my screen. Okay, can everybody see the full slide? Not the presenter view.
Yes.
Thank you. Okay, I'm going to dive straight in. This was quite a wide-ranging research project, and there are a number of findings to get through. So I won't give too much background to the SRD grant. I think a lot of people in the room will be familiar with the grant, but just to say it was introduced, it is the only non-contributory social assistance transfer available to working age, able-bodied adults in South Africa. And that must be seen in light of the structural unemployment crisis in South Africa, where more than 40% of working age adults are unemployed by the expanded definition. And there are very high rates of adult food poverty. So against this backdrop, the government has repeatedly stated that its policy intention is to expand the SRD grant into a comprehensive basic income support policy for adults. And with that in mind, this research seeks to inform that policy-making process to ensure that the eventual basic income support is designed in as inclusive and effective way as possible. And this all also is with regard to the constitutional obligation on the government to progressively realise the right to social assistance for those who need it. So a little bit more background to the SRD grant, and that's the value of the grant compared to the cost of living estimates in South Africa and the national poverty line. So you can see that the grant value, which is the bottom line in this graph, has remained relatively static. It received a small increase to 370 Rand from 350 Rand last year. It is well below the food poverty line, which is currently set at 696 Rand, and that is the level of monthly income an individual would need to meet their basic caloric intake requirements. So essentially, if you're falling below this level, you don't have enough food to eat. The grant value is less than half of the food poverty line. We can also compare that to the upper bound poverty line, which is the amount of monthly income an individual needs to meet all their basic needs. And that is 1,634 Rand. The grant is means tested, and you can see here the means test is below the food poverty line. The means test is 624 Rand per month. That's equivalent to the 2021 food poverty line when the means test was instituted. So there's a subset of the target population, a subset of people in food poverty who are not in the target population for this grant. Now, we already have a sense of the overall rates of exclusion from the grant, and we know that there's a very high rate of exclusion of people who should be eligible for the grant, and that's based on estimates existing in the literature, which range between 16 and 18 million estimated to be eligible. When you compare that with the number of applications, it's reasonably on par. At last count, there were 17.4 million existing applications for the grant. However, the government has only provided a budget allocation for the grant, which enables it to cover 8.5 million people. Approvals have hovered under that budget cap, with payments lagging slightly behind. While there is provision in the regulations governing the grant that says that the grant can stop being dispersed if the budget cap is reached, that has not been invoked. So the fact that approvals are hovering under the budget cap is, in the government's words, it's a reflection of true eligibility. In other words, all of the applications that have been declined on the grounds of ineligibility, not on the grounds of the budget having been exhausted. If we look at that another way, again, we can see applications have soared to above 17 million, while approvals and payments have remained relatively static. It's unclear why the number of approvals have not increased with the number of applications, despite this provision about the budget cap not having been invoked. So what were the objectives of this study? Given that we already know that about 50% of the target population is not able to access the grant, we don't have empirical data to show how those people have been excluded, precisely where in the grant cycle and by what mechanisms. We also don't know who is at risk of exclusion. And of course, the rationale of poverty targeting of social assistance is that it enables the limited resources to be directed towards those who need them most. So that's one of our questions. Are the people who are actually accessing the grant the most in need within the target population? And what is the impact of exclusion from the grant on individuals and communities? We used a mixed methods approach, which combined survey data and in-depth qualitative interviews. Our survey targeted people in the age range for the SRD grant, which is 18 to 59, who had monthly income below the upper bound poverty line, so who were living in poverty and who did not receive the SRD grant in at least one of 3 reference months. So in other words, we sampled for exclusion, some degree of exclusion from the grant. Our survey was offered in 4 languages, English, Setswana, isiZulu, and isiXhosa. And it was, we had a mixed data gathering approach where we conducted a number of surveys in the field in person. That was to try to control for the fact that we believe that digital exclusion, people without internet access, form quite a large subset of those who are excluded from the grant. And in addition to that, we had a number of survey responses facilitated by our partner organizations, Black Sash and #PayTheGrants, in person with communities that they work with around the country. The remainder of our survey responses were gathered via an online post. And in order to offset the costs of responding to our survey, we provided a modest compensation for data costs to those who responded online. 180 out of 1,080 survey responses were ineligible based on our above criteria. So they were from individuals who were not living below the upper bound poverty line or who had received the grant 3 times in the reference period and thus were screened out. And that left us with a primary sample of 900. We followed that up with 58 research interviews in rural communities in the Northwest near Mahikeng and in Kwamashu Township in near Durban and in Durban CBD. So we had both rural and urban populations represented. In terms of our survey sample characteristics, we tried as far as possible to match it to data from the South African Social Security Agency, SASSA, on the characteristics of actual SRD grant applicants. We weren't 100% successful in this, so our sample has a good balance of rural to urban. It was 44% rural, 68% female, which is a slight overrepresentation. However, there is an overrepresentation of women in applicants for and recipients of the SRD grant. Most of our respondents had a secondary education at matric, again, an overrepresentation of more educated persons. And in terms of the age distribution, our sample overrepresents people in their 30s and underrepresents people in their 50s. So based on this overrepresentation of younger and more educated people, we would suppose that our findings slightly underestimate the impact of digital barriers to access to the grant. And I think that's important to bear in mind as we go through the results. In order to understand the extent of erroneous exclusion, that is exclusion of persons who were eligible, we conducted our own independent eligibility assessment using the SRD grant eligibility criteria. So that is, they must be in the target age range, they must be resident in South Africa, they must be a citizen, permanent resident, refugee, asylum seeker, or special permit holder. They must not be receiving any other social grant in respect of themselves. So that's the wording in the regulations. In practice, what that means is they mustn't be receiving the disability grant. All other grants that people in this age category would be eligible to receive would put them over the means test for the SRD grant and thus would be cancelled out by the other criteria. They're not resident in a government-funded or subsidised institution. I'll come back to this point. And the most importantly, they must have insufficient means. This is the means test. It's defined in the regulations as income or financial support of less than 624 Rand per month. So the way that we assessed this means is that we asked people to self-report their income. We have no reason to believe that people would misrepresent their income to this survey. We made it very clear that their responses to the survey would not have any impact on their ability to access the SRD grant. We weren't surveying them on behalf of government agencies. So we took people self-reporting of their income on faith. The criterion on not resident in a government-funded or subsidised institution, that's not defined in the regulations. And when we asked this of our respondents, a lot of people said that they were resident in RDP housing, which is state-provided housing. We don't believe that constitutes a government-funded or subsidised institution where a person is having most of their needs met by the government. So we did not include that in our eligibility assessment, though we do suspect that when people answer yes to this question on the application questionnaire, they're not given the opportunity to elaborate as to the nature of the institution they live in. So some people may be incorrectly excluding themselves when they're answering yes, they live in a government institution, when in fact they live in RDP housing. So what was the extent of exclusion in our sample? 75.9% of respondents on average across the 3 months were eligible for the grant. 17% of respondents were approved for the grant. That's 24% of eligible people. 7.8% of respondents, or 10% of eligible people, were approved and paid. They received payment of the grant. So 71.7% of our total sample was erroneously excluded, or 90% of eligible people were erroneously excluded. They should have been able to access the grant and they didn't. Then we had a subset who were ineligible. Whilst they were living in poverty, they had income above the means test threshold, and they were approved for the grant, erroneously approved per the criteria. And then a smaller number of those were actually paid. So we would deem this to be erroneous inclusion. So for those who were ineligible and excluded by the grant system, these were still, by virtue of our sampling, living in poverty. 30% had monthly income above the means test threshold, but below the food poverty line. In other words, they're in extreme poverty. 37% had monthly income above the food poverty line, but below the upper bound poverty line. A significant majority agree or strongly agree that they are struggling financially. More than 50% agree or strongly agree that they don't have enough food to eat. And more than 70% agree or strongly agree that receiving the SRD grant would make a difference in their life. So what this tells us is that the means test may be set too low to actually be giving effect to the right to access social assistance for those who need it. In terms of erroneous inclusion, because we hear a lot about this in the media, is this welfare fraud that we're seeing? It's important to stress that we selected for exclusion in at least 1 month of the reference period. So those people that we found had been erroneously included had also been excluded at some point. So this can't be taken as an overall estimate of erroneous inclusion in the grant. 54% of those ineligible but approved were still living in food poverty. They had income above the means test, but below the food poverty line. So they were still in extreme poverty. And 49% had income between the food poverty line and the upper bound poverty line. Why are we seeing this rate of erroneous exclusion? We can speculate. We believe that that some child support grant recipients may be included in this data, which is incorrect. The child support grant should not exclude a recipient from receiving the social relief of distress grant. In addition, people with slightly higher means may be better able to overcome obstacles to application, payment, and receipt, despite being ineligible. We can also take from this that the eligibility verification methods are woefully flawed and inaccurate because they produce both erroneous exclusion and erroneous inclusion. And the simple impossibility of isolating the poorest of the poor at a means test of 624 Rand below the extreme poverty line. People move into and out of that category too often. It's fluid and it's very, very difficult to pinpoint eligibility at such a low means test. How were people excluded? So there are a number of points in the SRD grant cycle where exclusion can occur. First of all, you need to have the knowledge that you are eligible and the knowledge of how to apply. Then there are barriers to application. Application can only happen online. It can't happen in person, unlike all other social grants in South Africa. Then you need to undergo identity verification. This is a new requirement that was only beginning to be rolled out during the period of our research. And that happens remotely via facial recognition software. You need to undergo verification of insufficient means. That happens by bank account surveillance, facilitated by the banks, as well as government checks on other public databases. If your application is incorrectly declined, you need to appeal. The appeals process is also online only and also consists of rerunning these same automated bank and database checks. And then you need to be able to receive payment. You need to have a bank account in your name that is verified with the government agency. So there are a number of obstacles within all of these processes. So in terms of application, we saw barriers to application. As well as only being able to be made online, applications can only be made in English. So 25% of our respondents who had never received the grant in its current form had not applied. And we found that an average of 70% of this group had been eligible across the 3 reference months. So why did they not apply? 23% didn't believe they qualified, so this was a knowledge barrier. 17.5% didn't know how to apply, again, a knowledge barrier. 14.6% didn't have a device to apply on, so that's the digital barriers. And 11.7% believed their application would be declined despite believing they applied. So that speaks to disillusionment with the social assistance system, or a lack of faith. Barriers to eligibility verification. This is a slightly complicated table, but the most important thing to point out here is in the left column, the grounds that SASSA gives for declining application. So we asked each respondent, on what grounds was your application declined? And then we compared that with our assessment of the relevant factor. And we found, so we see that 71% of all rejections get made on the grounds of alternative income source identified. What that means is that applicant failed bank verification. And I'll come to that in the next slide. Another grounds was identity verification failed. That accounted for nearly 11%. We found that only 2.5% of our respondents reported not having a valid ID, and a number of other grounds for rejection, which for the sake of time, I won't go into in detail. Failing bank verification is a huge driver of erroneous exclusion. Bank account verification, as I said, consists of monthly surveillance of applicants' bank accounts. Any inflows into your account over 624 Rand per month are considered means for the purposes of income eligibility verification. But many bank account inflows do not or should not constitute means in the sense of regular income or financial support to which a recipient is entitled and which enables that recipient to support themselves. So, for instance, funds received on behalf of another person. This was very common. Intra-household transfers. Bank verification can double count money transferred from one household member to another household member that is used to buy or to purchase basic needs for both of those household members. So intra-household transfers are double counted by bank surveillance. Loans, we see people taking money from money lenders, loan sharks, which then show up in the bank account verification process and render them ineligible for the grant. And another big category of payments we found made people ineligible for the grant were what we call ad hoc donation. This is remittances or money sent by friends and family to enable that recipient to survive in a given month. Often because they have been unable to access the SRD grant, and because this is not regular income or financial support to which the recipient is entitled, we don't include it in our independent assessment of eligibility. So just to dive a little bit more into this issue, we asked people to elaborate on what the source of the transfer and the purpose of that transfer was that led to them being declined for the SRD grant. So this is a selection of responses. Somebody said that they received money on behalf of their mother for clothes that she had sewed as payment for clothes that she had produced. Somebody said they received money from a loan shark. Another person said a money lender so they could buy food for Christmas. Other people received money on behalf of children in their care. Non-payment of approved grants was another big driver of erroneous exclusion. So you saw in the graphic earlier that not everybody, and in fact, a minority of people who were approved for the grant actually received payment of that grant. An average of 44.5% of approved grants were not paid out per month across the 3 months. We asked, what is the status of your unpaid grants? 15.2% didn't know. 74% said that the status was pending, so it was just sitting there. And nearly 11% said that their grants had been cancelled. This was an interesting finding because it was only in the month that we began our data collection that a new regulatory amendment came into force, which allowed the government to cancel historic pending grants. So we're seeing this starting to be utilised by government agencies as soon as it comes into force. And they do this for applicants or for beneficiaries who are deemed to be untraceable. We'll dig into that a little bit more, but it essentially means people who have not been able to provide SASSA with updated payment details. And a large subset of these people had selected a payment modality when they applied for the grant. For instance, they'd selected to be paid through the South African Post Office. And that payment modality was later abandoned, retired, it is no longer an option for payment. So SASSA will go back to that person or try to go back to that person and say, you need to update, you need to provide us with bank account details. If they cannot connect with that person, if the person doesn't receive that request, if the bank details aren't updated, that person is deemed to be untraceable and their grant cancelled, their pending payment cancelled. We asked if people knew the reasons why they hadn't been paid. 59% didn't know. 6.9% couldn't complete identity verification, which is a necessary step in updating bank or contact details. A further 7% said they couldn't update their bank account details, and 12.3% said they'd been referred as fraud risk, or they had referred status. Now, that means that they had been algorithmically profiled by an opaque algorithm. We don't know we don't know the data that is used to do this, but they had essentially been algorithmically assigned a fraud score, which means that they cannot receive their grant payment until they complete biometric identity verification. So all of these three categories, one of the biggest drivers of non-payment is the biometric identity verification system. So I'll talk a little bit more about that. In order to undergo biometric identity verification, you need to be able to upload a high quality image of yourself that can be cross-referenced with the Home Affairs National Identification Database. And obviously that presents a number of barriers to people living in food poverty. It means that you need to have a smartphone, not only a smartphone, but a high quality camera enabled smartphone and a phone, and the same phone number that you used to apply for the grant originally, because you need to be able to receive the link, the SMS to that phone number. In addition, you need to have a smart ID card. There are currently two legitimate forms of identification in South Africa. One is the smart ID card. One is the older green ID book. If you have a green ID book, your image cannot be matched to the Home Affairs database. You cannot undergo biometric identity verification. We also know that biometric verification is now going to be applied to all SRD applicants, not only those who need to update their details or change or clear their profile having been flagged as fraudulent. So we, in light of this, wanted to see what proportion of our sample has the capabilities to undergo biometric verification. So a number are already ruled out by not owning a smartphone. Within those who own a smartphone, this is the proportion who used that same number to apply for the grant. This is the proportion who has internet access, at least sometimes. And this is the proportion that has a smart ID card. So you can see that a minority of our respondents would be able to complete biometric identity verification. And we believe that this is going to emerge as a much more significant driver of exclusion now that it's being applied to all SRD grant applicants and possibly across the social grant system as well. Then there were barriers to appealing a rejection. So most of our respondents who had applied for the grant had appealed a rejection at least once. Only 5.3% had ever had a successful appeal. So that's not disaggregated by month, that's any successful appeal in any month. And importantly, appeals of rejections that were made on the grounds of alternative income source identified or failing bank verification checks were much less likely to be successful. And to illustrate that further, this is old data. We don't have updated data on appeals from SASSA, So this is from 2022. The bank verification system began to be applied from May 2022. And this shows the proportion of appeals that were successful, the total proportion of appeals that were successful per month, and the proportion of appeals of rejections on the grounds of bank verification insufficient means. You can see that up to 1.5 million people appealed a rejection in each month, and the majority of those appeals were for rejections made because of bank verification. 0 appeals of rejections made because of bank verification were successful in each month out of nearly 1.5 million. And that is because when you appeal, the appeals process consists of pressing a button that will automatically rerun the same bank verification check. Appellants are not permitted to provide any new evidence or information on appeal. You cannot motivate your appeal. You cannot tell SASA that the money that you received in your account that month was not for you, but for a child in your care, for instance. So the appeals process simply is not providing administrative justice in the context of high erroneous exclusions. I note that I'm running a little bit short on time. I'll try to go through the remaining slides as quickly as possible. Who is most at risk of erroneous exclusion? Are those people that are being included that are successful? Are they the most in need? We looked at the characteristics of each of our respondents and we sought to understand which characteristics were correlated with a higher risk of not applying, not being approved despite being eligible, not receiving payment of an approved grant, and not appealing a rejection. So just to take you through these, we see that digital exclusion, not having access to the internet or devices, plays a significant role across all of these parts of the grant process. Lower access to devices and internet means greater risk of exclusion. Of course, those people who have lower access to devices and the internet are more likely to be the poorest of the poor, if you like, those with the lowest means, those most in need of the grant. Gender also played a role. So women are much more likely to receive the child support grant, and they're much more likely to receive maintenance payments for children in their care. They're also more likely to use the bank account of another person. And all of these things rendered you more at risk of being excluded from the grant. Interestingly, child support grant recipients were more likely to apply, but they were more likely to be rejected as well, to have their application rejected after they applied. Then they were less able to receive payment of a grant that they had been approved for, if they were able to be approved. Financial exclusion also played a role. Not having access to the formal banking sector, not owning a bank account, sharing a bank account with somebody else, put you at greater risk of exclusion. People who didn't have bank accounts were less likely to apply for the grant. People who had bank accounts were more likely to be rejected for the grant. So what we see is the bank verification system playing a role here. And then not having a bank account made you more likely to not receive payment. So you're damned if you do and damned if you don't. The system penalizes not owning a bank account, but it actually also penalizes opening a bank account. People with lower levels of education were more likely to find the application process difficult and were less likely to apply. They were also less likely to receive payments of approved grants and less likely to appeal. So this speaks to the complexity of the application system and also to the fact that that applications are only available in English, which a vast minority of the population speaks at home. in South Africa. Unfortunately, refugees, asylum seekers, and special permit holders were a very small subset of our sample at only 1.6%. But what we found is that they were overrepresented in those who did not apply despite being eligible. So they were much less likely to apply, in other words. And our qualitative interview findings, we dove deeper into what we know from our data about exclusions. We wanted to understand what the impact of exclusions had been on people who'd been excluded, how they felt about it, what their perceptions were. And I'll go through these quickly. What came through very strongly in our thematic analysis of the interviews was a sense of disillusionment and defeat. I was just defeated. I got fed up in the end. The appeal doesn't change anything. People abandoning their applications and their appeals because they didn't have faith that they would be able to access their rights. And this had significant psychological impacts. One interviewee said that not receiving the SRD grant had made them contemplate suicide. It was very painful and their heart was so broken. This damaged me emotionally. I'm stressing about my children and my family. And somebody described how much it hurt that they were unable to provide for their children. People tried to access assistance and often they incurred costs trying to do this. You're not actually able to get assistance for the SRD grant from the SASA offices in person. Despite this, people went to the offices, they stood in the queue, they paid the fees for transport to get there, and were not actually able to go back because they didn't have enough money left over for transport. There's also a call centre, and we found that the call centre was not seen to be very helpful. She didn't answer me, the phone just disengaged. The phone rang without answer. Those people don't answer phones. I phoned SASA offices many times and they have not assisted me. People spoke about digital barriers, not having a smartphone in order to apply, having lost the smartphone and the number that they applied on so that they couldn't update their details, not being able to complete biometric verification, and simply lacking digital literacy, not knowing how to use technology, so not being able to apply for themselves. People also spoke about frustration with demonstrating insufficient means, failing the bank verification system, and not understanding why, or believing that it was due to money they received that was not for their own use. The fathers of my children send me money, that's for the children. There's an interesting quote here at the bottom from somebody who tried to send money to their sibling to pay for their mother's doctor's visit. So there's a younger sibling from home. My mother was sick and needed an amount of about 300 to go see a doctor. I had money at that time. I took the money and deposited it into the younger sibling's bank account, and he got seriously angry. He said to me, "You are not supposed to deposit the money. I won't be able to get my 350 anymore." I didn't understand what he was saying, but it seems like his 350 really didn't come through. Being excluded from the grant left people vulnerable to hunger. People talked about having previously received the grant and using it to buy basic staples, maize meal, toiletries, sugar, meat, cheap vegetables. It was little, but I bought food for my children. And since those respondents were no longer able to receive the grant, they go to bed hungry. There are days we sleep hungry. There are times we sleep hungry. We don't have food and the children are hungry, and people resorting to begging. So this really starkly underscores the fact that the grant is a lifeline for people who are vulnerable to extreme levels of food insecurity, and receiving it and not receiving it is the difference between eating and not eating. The grant had also enabled people to undertake income generating activities to improve their livelihoods going forward. Somebody had used it to start a business, a small business, but their receipt had been disrupted and that business was no longer operational. They no longer had income. Somebody had used the grant to buy stock or assets and care for their family with the proceeds. Somebody had used it to sign up to a community savings scheme. And when they were no longer able to contribute to that scheme because they stopped getting the grant, they were forced to borrow money, go into debt. And another person spoke of having to go into debt when their grant receipt was disrupted. So in conclusion, a very high proportion of exclusions of those in poverty below the upper bound poverty line are erroneous. But those who are correctly excluded, so they have income above the means test, still have a very high level of need and exposure to hunger. Right now, bank verification, or during the period of our study, bank verification was the biggest driver of erroneous exclusion. However, biometric identity verification is also likely to become a very significant driver. And so what we're seeing here is the automation and the digitalization of the grant system serving to exclude, profile, surveil, punish beneficiaries and prevent them from accessing their rights. And I think very importantly, those already vulnerable to intersecting forms of social exclusion and marginalization on the basis of gender, age, education level, as well as where they live, spatial exclusion, their access to digital devices, their access to the formal banking sector, their access to forms of identification. It's these groups who are more likely to be excluded from the grant. So the design of the SRD grant, the narrow poverty targeting, it does not direct limited resources to those who need it most. In fact, it serves to exclude those who need those resources most. Our report has a number of policy recommendations that can be taken from this and implemented in the development of the basic income support system. There are concrete policy recommendations in terms of targeting methodologies that we urge policymakers to take into account. There are ways that the basic income support system can be made more inclusive, even within fiscal limitations, even within a limited budget allocation. There are critical changes that need to be made in order to ensure that that basic income grant is as inclusive and effective as possible. Thank you.
Thank you, Kelle. Thanks a lot for that presentation. Now we'll open the floor to our panelists who will come in and give us our reflections for around 10 minutes or anything less than that. Starting with Siyanda from the Black Sash.
Thank you so much, Siyanda and Kelle, for the presentation and the research study. That was really insightful. I will really be sharing and reflecting on the experiences that we get from our client when they call into our helpline system. So maybe just to give a background, last year, the Black Sash Helpline responded to 2,600 inquiries. And on that 2,600 inquiries, 60% of those inquiries were related to the SRD grant. And the reason really why social grant beneficiaries would come to us is because SASSA and the system out there has failed them. So they would come to us because there is no recourse that is available to them at that particular time. And one thing that we have realized and noticed when we interact with clients is that mostly the youth are able to interact better with the system other than the older generation. So normally what happens is that we would go out into the field or do radio interviews. Last year in particular, we had a radio interview at Umhlobo Wenene, a radio interview, which is widely listened to by people in the Eastern Cape because it's in Xhosa. And one thing that we realized after the call is that people started calling in, especially the elderly people in rural areas that has been excluded from receiving this grant. One, they are calling in because either they had applied a year ago and have not received the money. So they don't know how to interact with the system, this elderly beneficiaries. Two, we know very well that data is expensive. And yes, the SRD system is data free, but to do other things, to appeal on the SRD system, you need to have data. To access the links on the SRD system, you need to have data. To do the verification on the SRD links, you need to do data. So therefore, mostly the elderly people in the rural areas, once they apply for the grant, they will sit and wait and hope for payment. They can't go back to interact and check as to are they approved, are they declined, or what is happening with their grants. And also we've noticed that with mostly elderly people, 45 to 59, they use their children or grandchildren to apply for the grant. And at the time when they're supposed to be interacting with the system, or when they request assistance from the Black Sash, you would ask them which number did you use to apply on the system. They would not know because they are not the one that were really interacting with the system. And also that leads to personal information being exposed. We've realized that most people, especially in rural areas, they will pay a fee to internet cafes so that they can access the system. So therefore, their personal information is now being exposed to third parties. And this is mainly because this grant is mostly online. So we also have those a systematic exclusion that obviously Kelle spoke about, which I'll delve a bit deeper in. We have those applicants that have been approved. So they've went through the whole system, the verification and everything. So SASSA then proves that this applicant is eligible for this grant, therefore they approve the applicant. But one thing that we've also found out from that is that then the person is approved for a longer period of time without any payment. And once they are approved, there's no communication from SASSA as to what the challenge is and what you can do as an applicant to receive your grant. Not so long ago, I was dealing with a case from the Eastern Cape where a beneficiary was approved from August 2021 to January 2025 without any payment. However, when we interacted with SASSA trying to find out what are the challenges, why has this person not been paid, there is a question on the application that asks if you are a shareholder or a director of a company. And the beneficiary, while applying, chose that she is indeed a shareholder and a director of a company. But the company that she was referring to was a company that has been dormant and deregistered on the system. The company had not worked or did any type of work, therefore making her eligible for the grant. But because now there is no communication between SASSA and the beneficiary to say that, look, you've been approved for such a long time, and these are the reason why we're not paying. So the beneficiary would not know the reason why they've been approved for such a long time without payment. We also have the new one that Kelle spoke about, the identity verification. When this was introduced, it was on some KYC, know your client. However, there are also those beneficiaries that needed to do identity verification because of fraud. We've seen last year the hike of fraud when the 18-year-old needed to apply and the application was already active on the system. However, with the what is challenging with the identity verification and requiring link from SASSA is that the links are not forthcoming. So this becomes then another way of a systematic exclusion, because if you say to an applicant, you need to verify yourself that you are indeed the person that you say you are, but you are not sending the applicant a link to verify themselves. So then that becomes a challenge. It's another systematic way of people really being excluded from the system. So links have not been forthcoming. Earlier this year, SASSA did actually issue out a press statement that the link system has been verified. I am glad that now the link thing is working, but that has also been a biggest challenge of people not really accessing this grant. We also have those, and we are also very much aware that sometimes as people, we lose our cell phone numbers, or you need to change your cell phone numbers, or due to fraud, they take your cell phone. So now needing to change your cell phone number, you also need the link that is still not forthcoming. You see, so then it's another challenge of people being systematically excluded. Also, there have been a sample and random where people are randomly selected for them to do the identity verification. One thing also, there is the issue of, so you have applied as the applicant, you are in the system, and you have been declined. Kelle did mention that the biggest decline really come from the means test identified. But one thing that we have also noticed from our side is that, one, you need data to actually appeal for that declined application. And one thing that happens is that you are not even notified that you are declined. So you would only know if you interact with the system. And so many people, once they apply, they don't interact with the system. They sit and they hope that they will receive payment because they know that they qualify for the grant. And another challenge is that lack of supporting evidence, lack of the fact that once you've been rejected, you cannot submit any supporting document to plead your case, then that also becomes a challenge. Therefore, most people that have been declined, especially on means test identified, then the appeal, because they used the same system to run the appeal, then they are automatically also excluded. I will be concluding. So in conclusion, the SRD grant should be treated like any other grant. We cannot have an SRD grant that is treated as in a form of a pilot. You know, it should be treated like any other grant. People should be able to go into SASSA offices to apply for this grant. You know, and as we fight for justice, dignity, and economic inclusion, the SRD grant cannot be used as a game of luck. It cannot be a game of luck where this month you are included and the next month you are excluded. You know, it cannot be that. So with all that being said, I think we should also not be apologetic when we are demanding for universal basic income grant. Based on the research, I think the best way to move of this is the universal basic income grant. Thank you.
I thank you, Khotatso. I think that really helps further contextualize these findings and the extent of exclusion. I'll now call up on Dr. Wiseman Mafasela to give his reflections on the presentations we've heard from Kelle.
Well, thank you very much. Good afternoon to Melang Sanbonani. I hope I am audible.
You are, yes.
Thank you very much. Now, I just want to start by highlighting what I think are three important achievements that this study makes. First, I do think that this study makes an important contribution in the literature and evidence around policymaking in the social assistance area. This study is important in the sense that it demonstrates to us that even exclusions over a short period of time have a direct impact on individuals as well as households who happen to be excluded from social assistance programs. Further, and I think this is very, very important, is that the study clearly demonstrates and it shows the contradictions in the SRD grant program between the policy objectives as well as policy implementation in a developing country context. We have targeting through the Social Relief of Distress grant, which is significantly missing those very people that the grant targets. So it really indicates then contradictions between policy objectives and the implementation processes. The research further brings to the fore the challenge of digitalization in social protection in instances where planning, implementation, and support tools and systems are not in place. Especially as one reads in the literature, there is a lack of a robust, dynamic, and adaptable social registry in South Africa that could have been used, which in the absence of this kind of social registry, we're then finding the Department of Social Development and SASSA scrambling around really by using other systems that were not designed for the specific particular purpose. Hence the emphasis on an adaptable and dynamic social registry. So there are several points really that I would like to mention and explore that really arise from the study that was conducted. I think what is important is that this study makes it clear that we have to understand what happens when targeting fails. What are the implications to households as well as individuals when targeting fails? Now, this is not just a case of some people being missed. This is a social and economic rights issue. It's a human rights issue. It's about human dignity. It's about equality. It's about non-discrimination. And as we all know, I would like to assume, these are foundational values of our constitutional order. So it then begs the question of whether some of our policymakers have become insensitive and have become inert to the social manifestations of policy and program failures. What is the meaning when so many millions of people are excluded from a grant that by right they are entitled to? So this study really assists in bringing to the fore what the ramifications of exclusion. Now, a further point that I also want to make is really that what we are saying, which this study also highlights quite clearly, is a divergence between policy objectives and the systems that are employed to meet the policy objectives. Now, when we look at the SRD grant, the stated objectives of the grant and the systems that are utilized to implement this grant, they are at variance. And they are, to a large extent, contradictory. We are part of a country where there is the principle of Batubile, people first. And there is the commitment in to the fight against poverty. At least that's what we're being informed. And also, when you look at what President Ramaphosa announced when this grant was introduced, and also you look at all the State of the Nation addresses by all our presidents in the past 31 years, quite central is the emphasis on fighting poverty, on finding ways in which to resolve the poverty challenge in South Africa. So what we are then seeing in this instance are really contradictions between the policy objectives and the implementation systems that are in place. So it is almost 5 years since the SRD grant was initiated, and there's been enough time to correct the shortcomings. And I want to emphasize this point and make it very, very clear that the exclusions are too high, and they render the SRD grant program questionable from a rights perspective, because at the center is a violation of rights. At the center is the denial of access to entitlements that these fellow South Africans have. The further point is really around the design of policy and implementation systems that are fit for purpose. Let's underline that, a system that is fit for purpose. As the study indicates, South Africa has got several intersecting exclusions. The study mentions spatial, financial, administrative, and digital exclusions of most people in South Africa. Research has really shown that the patterns, for instance, of former homelands are still evident in modern day South Africa. So for the SRD grant, when we look at the system that was adopted, what we are seeing is a system that is not fit for purpose is being implemented. Now, one should then be able to describe and characterize the system. It is really arbitrary, it is irrational, and as the research shows, that approximately half the target population is excluded from the grant. The question is, how is this justified? Hence, I'm making this point that there is the challenge of designing systems that are not fit for purpose. Now, the other point that I do want to raise and mention is really around communication. Fair enough, and I fully agree with this. The study does point out the shortcoming of only having English used as the medium. But for us, or rather for me, it's actually more than that, in the sense that the issue of communication is not just language only. It's about the reach and effectiveness of communications under what I call the erratic implementation decisions that have come to characterize the SRD grant. Very quickly, just to illustrate this point, when we did the research for the Department of Social Development back in 2021, this is what was the case at that point. The grant was originally intended for 6 months, and extension number 1 was for 3 months. After extension number 1, there was extension number 2, which was for 3 months. After the second extension of 3 months, the grant was discontinued for 3 months. After the 3 months of discontinuing the grant, it was reintroduced for a period of 8 months. And during that period of 8 months, it was the third extension, which was for 12 months. Now, this research was done in the period December 2023 and January 2024, and there has been numerous changes to the regulations. So when you speak communication, it's not really just a sake of using the other official languages of South Africa. It is being able to have effective communication in a context of erratic decision-making, where you expect citizens to understand all these multiple changes that indeed have happened. The last point that I would like to make, I do have further ones. I could probably raise these ones at another point in the discussion, but the last one that I want to raise at this point really is that what is the policy and implementation model that the SRD grant is based on? What is the model that SASSA and DSD have adopted implementing this grant? That model, we obviously have certain assumptions about the size of the population that's being targeted, about the geographic location of those who are targeted, about the budget, about the reach, and about the coverage. These are all relevant factors that are central in understanding the drivers, the impacts, as well as identifying those that are at risk of exclusion. I do think that rather than the Department of Social Development and SASSA only saying, oh, these are the numbers that we are reaching, we deserve, as South Africans, to be provided the model that is being used. Thank you very much. I will pause here for now and hand over back to the facilitator. Thank you.
Thank you, Dr. Wiseman. We'll now move on to our last panelist, Dr. Stephen Q.
Thank you. Thank you very much for the invitation to speak here. Can you see my presentation fine?
Yes, we can see it.
Yeah, so first I want to congratulate the researchers and the team that did this. It's a fantastic piece of work, really delving down into the challenges of a doing a means tested benefit. What I encourage you is to put the report in a much more accessible format as well, because I think many people are not going to read the whole amount. There's so much rich information, but something that's a glossy format, 10 pages would be great to give it to get it out there more to the population, not just in South Africa, but outside. But I wanted to start in terms of giving my comments, I think, on the very first sentence in the report, which Kelle also alluded to about the reason that, used for targeting of social assistance transfers is about, about it's fair in allocating limited resources, especially low and middle income country context. And I think what this report shows is this statement is just nonsensical. It's unfair. And as I showed, it's unfair everywhere. And this is a particularly unfair way of allocating the resources, which we should say are never limited. There's always a political choice to have a small budget. They're not limited. You could always tax more and increase your budget. And the program itself is the CRD is a classic example of this idea. This term that a benefit for the poor is a poor benefit or a poor quality benefit. This is just a perfect example of this. I mean, you can just imagine the sitting down thinking around, oh, how are we going to target this? How are we going to do it efficiently using algorithms and digital means? Let's use a bank account. Let's get into a bank account. How can that fail? We'll really know how much money people have got and will give us perfect targeting. And everybody buys into that. They implement this. What has turned out in this report has been an utterly ridiculous system of targeting. And the report just does a brilliant job of showing how nonsensical it is to use bank accounts as the basis of targeting for the many reasons that Kelle set out. But what I'd like to say, the global perspective, I think we always know that all poverty targeting always fails everywhere. This is the results of targeting, looking at low and middle income countries around the world, of programs targeting less than the poorest 20% of the population. And we can see the kind of exclusion areas that we have. The very best was 44% exclusion error globally, getting up to almost 100% in some programs. This is just a normal thing, right? What you find with the SRD grant is just normal globally. And it's not just a problem in low middle income countries. These are the exclusion rates that were found by the UK's National Audit Office, where we have much more robust systems of means testing of people who are applying for benefits, of around 10 of the largest means tested benefits in the UK. And you can see the exclusion areas as job seekers allowance at the time was a very large program. Almost 50% of intended recipients were excluded. So we can't get it right in the UK with much more robust systems of means testing, it's highly unlikely that in South Africa you're going to do much better than this. And I think the exclusion errors are almost certainly going to be very, very high. When we looked around the world and we measured the areas of different benefits from universal to poverty targeted, we sort of mapped them here. Further to the right, a program has a higher exclusion error. The further up it is, the more the higher the coverage, the more universal it is. And you can see all these programs that were down here, the poverty targeted, which are very high exclusion errors, just to see. And if you were to just look at this, the trend line that we have here, if you look at the SRD grant, it's around 20% coverage of the adults, working age adult population in South Africa. You would expect, if it was done reasonably well, to have just 50% exclusion. That's probably as good as it's going to get, and it seems to be much worse than this from the results that from the study that's been shown. But the problem means testing is much broader in South Africa. The other programs, child support grant, for example, you'd expect child support grant to be much better targeted, to be well targeted. And in fact, we did analysis of the data set a few years ago in South Africa, looking at child support grant for single caregivers. Look at the means test. You can see the red line where we ranked families from, or caregivers from, the poorest to the richest. 95% should have been eligible for the child support grant, but you still had 22% of eligible families were excluded as a result. So even when you're getting almost everybody eligible, still, because of the very fact that you're using means testing and all the barriers that this puts in place, you still end up with many of excluded, including amongst the very poorest families. And I think, as Kelle alluded to, it's around the kind of income dynamics is one of the challenges that you have. People's incomes are changing all the time. Well, we don't have data in South Africa. I took this data set from Uganda, a panel survey data set, where we could look across 2 years where people were ranked from poorest to richest in Uganda. And you can see in the orange, the poorest 20%. By 2 years later, it's completely changed. There's many, about half of those have dropped into poverty just 2 years later. We've done this looked at this in many other countries. You get similar patterns here, and with very, very dynamic nature of people's incomes, it's impossible to target. And this idea that there's a group called the poor and the non-poor, which fixes our way of thinking, and influences how we can target this supposed group of the poor, it's really just a fictional construct. And so it makes means testing, poverty targeting, almost impossible, well, pretty much impossible to do, what is impossible to do accurately. If you looked at the income distribution in South Africa, this was taken from the last household income survey there, you can see that from the poorest to the richest, most households are relatively similar, because high levels of inequality in South Africa. And it's very difficult to tell between the two. So if you're targeting down here the poorest 20%, there's very little difference on either side of the line. How on earth are you going to be able to identify people, particularly when incomes are changing all the time? And the SRD benefit shows that it's really impossible to do it there. In effect, if you take an analogy of what a means test, what the SRD target is like, it's like this is you see here. This is the very first photo that was ever taken in the history of the world, right? This is the very first photo, and it's almost the analogy of the SRD target is like this photo, right? It's just so bad, it's so blunt. You can really not tell. You can't identify people accurately at all. And what you really need is a high quality video, that you can then, similar. This is what you need to do. You're targeting something that follows people and is very dynamic. And at the end, we get Ronaldo scoring. And that's what you need. But to get something like this, it's really expensive, right? And if you want to do good means testing, you're going to have to spend a load of money doing it. And something like you have with the SRD, is just a very cheap means of doing it. If you do it cheaply, you're going to get very bad results. I noticed that Wiseman noticed that, you know, the way ahead is social registry in South Africa. I would caution against the social registry. They're just the same. They're arbitrary. They're irrational. They have failed in every single country they've been used. The myth of the dynamic social registry does not exist. So I would absolutely caution you in South Africa not to move towards the social registry, despite the fact that the World Bank is trying to push every country to adopt this. I call them anti-social registries. But as get, you know, I think the basic point that we need to remember is that when we're using poverty benefit, poverty targeting, and means testing to create these poverty benefits, who are the real beneficiaries of poverty benefits? It's the rich, right? They're the main benefit. It's not the poor. When we target the poor, it's the rich who are benefiting. I just want to illustrate this from looking at two social security systems around the world. One, Georgia, which has most of its benefits are universal, going to everybody. And you can look here at the impacts on consumption when we take into account the tax that is paid to finance the benefits and the benefit itself. Okay, and you can see here at about 70%. On the left, we have about 70% of the population here who are net beneficiaries. They receive more than they're paying tax, so they're net beneficiaries. The biggest beneficiaries of universal benefits are the poorest. The net funders are the rich because they're paying more in tax than the than they receive in the benefits. So they're net losers in a way, but it develops it from the universal benefits can develop a much fairer system and effectively a good system of targeting if you take into account the tax and those that are paying in a progressive tax system more tax for the benefits. If you were to look in contrast at the Philippines, where spending much less, 0.4% of GDP on poverty benefits. You can see here that in the blue line, the change in consumption is almost negligible. There's almost no change. The poor aren't doing very much better. The rich aren't really losing out very much. You see the orange line where it's zero. We can't see really any difference. And this is why the rich prefer poverty benefits. They're the main beneficiaries because they pay much less tax. You know, and when we've got highly unequal societies like South Africa, what we need to be moving towards is more universal benefits. You know, make the child support grant universal, the old age grant universal, the disability grant universal, as we have found in many other countries, to make them much more effective. And when we take into account those paying tax, we'll already have an inbuilt form of targeting because those paying the most will be receiving much less. Just some final comments on the last slide. One, I think World Bank just put out its State of Social Protection report a couple of days ago for 2025. They make this nonsensical statement there. Improving the poverty targeting of existing social assistance programs in the low middle income countries could virtually eliminate extreme poverty in half of the countries that have an extreme poverty headcount below 20%. I think the SRD benefit illustrates that. And other benefits around the world. You cannot do the perfect targeting that the World Bank is doing. You will always, with means testing, have very significant exclusion areas, as I showed. Even in the UK, we have significant exclusion areas. This idea that means testing is the way ahead to eliminate poverty, reduce inequality, is absolutely wrong, even though it's propagated strongly by the World Bank and other institutions, and alongside the push for social registries. Further comment. Out of interest, I would just like to ask, I mean, I felt very uncomfortable to see that the state in South Africa is accessing people's bank accounts, private bank accounts. I'd hate for the UK for people to do that. So I just wondered, is that a normal practice in South Africa? I guess a much bigger problem than the SRD mistargeting is tax avoidance, perhaps among the better off. Is the state actually going into the bank accounts of the better off, or is this just discriminatory against poor black people in South Africa by just going into their bank accounts? But the rich, the state isn't going and exploring in their bank accounts. If not, it's discriminatory, as I say. And it's always been mentioned, I think, you know, looking at the situation in South Africa, I'm not always a big proponent of universal basic income, but I do feel in South Africa, given the inequalities there, the fact that so many people can't work, is that perhaps is a universal basic income the answer they're the only way. And I think this report shows that if you don't follow this, probably you're going to leave the majority of the poor behind there. So there needs to be something done differently, and perhaps, to start off, reduce the age of the old age grant to perhaps 50, give people in their 20s a basic income grant, those that starting getting the labor force, those that are through disability more likely to be out, start there by doing that, and then gradually close the gap in age if really it is a big problem, the funding for this. But yeah, but I'll stop there and just once again congratulate the authors on a fantastic piece of work.
Thank you, Dr. Stephen, and thank you to all the panelists and Kelle for your presentation. So now we're going to be moving on to the Q&A session, but we are slightly over time. So at past, if any of the panelists or any of the attendees need to leave, then I think you're welcome to do so, but we can open Q&A for 10 minutes, because I see already in the chat we had some questions which I've noted, but also you are free to raise your hand using that functionality here, and we'll let you ask your question. So maybe I'll start with some similar theme that I saw in the chat. In a number of questions, a lot of people are asking about fraud, which I think is for sure understandable, and with the things that have been happening in the last couple months. So I just want to read one of the questions, and then I think I'll let Kelle come in and answer. So Candice Gao asked, why do we continuously observe fraud-related cases when it comes to the management of the SRD? In rural villages, we continuously hear of imbombozi who are non-existent or bodiless beneficiaries.
Thank you so much for that question. I think that there are a few important things to note in response. One is that we do certainly hear a lot about fraudulent inclusion in the system, but what we demonstrate with this research is that fraudulent inclusion is quite minuscule compared to erroneous exclusion. So it's a much more minor issue than people actually who are entitled to the grant not getting it. But that said, what we would also emphasize is that the rapid automation and digitalization of the grant system has paved the way for large-scale fraud to happen. So people will be familiar with the scandal where a number of 18-year-olds found that their IDs had already been used to access the grant. That was made possible by the automation and digitalization of the grant processes without adequate human oversight, without adequate accountability. And in response, the government has doubled down on this strategy. The biometric identity verification system is a direct response to this issue of the large-scale fraud being uncovered, and it does not address the problem. All it does, as we outlined for many reasons in the presentation, is serve to exclude further people who should be eligible for that grant. So the only way to address the issue of people perpetrating large-scale frauds in the grant system is to open up alternative options for people to verify their identities and to apply for the grant, and also to make the grant generally more accessible, but with greater human oversight, a greater human face, and more accountability.
Thanks, Kelle. I don't see any new hands, so I'll go with another theme that I saw people raising, which was budget allocations and whether exclusions are intentional. So I'll just read one of the questions we got, but the others are very similar. Mathematically speaking, only so much gets budgeted for the SRD grant, and therefore only so many applications can be approved and then paid. And therefore the deterrent mechanism should not be a surprise. I don't think the application process is an issue, as that can be sorted out with ease. So while questioning what seems to be intentional, is something else we should be questioning, whatever that is.
Thank you. I'd also invite any of the panelists to jump in if they want to respond to questions or raise their own. But this is a very astute observation, and we believe that this is the case, that the government has been forced by the arbitrary budget cap to find ways to deter people from applying and to find ways to institute obstacles to receipt of the grant in order to remain within the budget cap without having to say to the 8.5, the next person after 8 million, sorry, the budget's run out. So this has been essentially admitted as well by the Department of Social Development in a presentation that they gave to Parliament at the time when the National Treasury instituted this arbitrary cap. They said, we don't have enough money to pay all the recipients who need, to pay all the beneficiaries who need help. Therefore, sorry, my Siri is talking to me. Therefore, we need to institute additional barriers. And this was put up as evidence in the court case that IEJ and #PayTheGrants brought on the social relief of distress grant to say that these barriers have been instituted intentionally, deliberately to limit disbursements to that budget cap.
Right, thank you, Kelly. I see we have 2 hands, so I'm gonna allow the people who have their hands raised to ask the question, starting with Gabriel. You can unmute and ask your question. Oh, okay, maybe having an issue there, but I see the question. You also popped the question in the Q&A. So it is, I'm having a challenge with a beneficiary who doesn't have a phone at all. How do I assist the person?
Okay, thank you for that question. Just briefly, I would say it's possible within the rules to apply on somebody else's phone. So for instance, you could let that person apply on your phone, but they need to have ongoing access to your phone in order to receive communications from SASSA. So if you receive a message on their behalf from SASSA, you need to be able to go back to them, find them, tell them about the request and help them to respond.
Okay, thank you, Kelly. Let's try it again. Sfiso, I see your hand is up. Are you able to unmute and ask your question?
Oh, thank you. Thank you to the presentation and all the input that we've received. Mine, I just want to find out something. The whole process or the whole intervention by government is meant to be a short-term solution or a response to a crisis. Currently, the crisis that we're dealing with is poverty and also unemployment. So that naturally is supposed to be a short-term intervention. But in the case of South Africa, it seems as if it is now becoming a long-term or a permanent feature of our budget, our state budget. This provision of social grants to poor people and those who are deserving. The economic justice much as this affects economic justice, but I think from that justice perspective, it should be a short-term solution. We should by now be pushing government to actually make more meaningful intervention for these people to get out of the system and be self-sufficient in terms of economic development. Not saying that we should ignore the issues that they are currently faced with as far as the system is concerned. There's a lot of issues as far as the system is concerned. Where I disagree with the doctor is in her findings regarding the minuscule of fraudulent recipients of the grant. I don't know. Maybe I may want to interrogate your research more and see how you came out to those, because what is out there is shocking in terms of how many people cross the border from Swaziland every month just to collect the grant from the surrounding countries. So I don't know. Yeah, but there are those issues. But my point here is in the system itself. It's embarrassing that 30 years later we have made this a permanent feature of our budget as a country. It means we are not progressing to the level that we're supposed to be progressing. We are comfortable with seeing poverty being permanent in our society. So how can such research inform government or push government to actually make more meaningful intervention in terms of developing our economy so that people are self-sustainable economic-wise? Thank you.
Okay, thank you, Sfisa, for your question. So I see that we're almost out of time. So what I'm going to do is we'll just take the next two questions we have as well, and then we'll allow the panelists to answer. Just before we close, I would like to also encourage everyone, if you haven't already, just take a look at the chat and you'll see that there's a lot of useful information that's been posted there. Not all in the form of questions, so won't all be asked there, but please make sure that you take a look there. So now I'll ask Mpho if you can ask your question, just unmute and can start speaking.
Thank you so much, and to you, Dr. Howson, for the presentation. Mine is just very short. I'm not too sure if the study interrogated some of the reasons or factors why would individuals, fraudulent the system. What are some of the pertinent reasons why would people, just ethically go outside everything or out of their way to, just be fraudulent to the system generally? Thanks.
Mawuto. The hand has gone down. Well, there's just two more in the Q&A, and then we'll let the panelists answer. We can close. Is it normal for the government to trace bank accounts as highlighted by Dr. Stephen Kent? And then can you suggest a pathway for linking SRD to economic opportunities?
Okay, thanks for the questions. I'll go through them as quickly as I can. Sifiso, do we need a more meaningful intervention to drive economic development and economic transformation? What the evidence internationally shows is that investment in social protection spending is a developmental intervention. Poverty is the biggest obstacle for people being able to enter into employment, start enterprises, improve their livelihoods prospects. So before the government can do anything else like create job opportunities, there needs to be a foundation that people can build on in order to have their basic needs met and then improve their livelihoods. And there's evidence from all over the world which shows that social protection spending creates economic activity. It flows back into government revenue through things like that. It increases consumption in local communities. It supports local businesses. So it is a developmental intervention, in other words. The issue with the SRD grant is that it's not enough. The value's not high enough and the coverage isn't high enough. And if the value and the coverage were increased, we would see a larger multiplier effect where that intervention is one of the most direct ways that we can address the immediate crisis of hunger and economic exclusion, but also help people, give people a foundation on which they can improve their lives and their livelihood prospects over time. Why do people defraud the system? I mean, I wouldn't want to speculate on this because you're right. The research didn't investigate this question specifically. Obviously, you know, I think there are bad actors out there who are motivated to access funds that they aren't entitled to. I think that in terms of the actual motives for that, it makes a lot more sense if you are able to defraud the system on a large scale, right? It's not that you're not getting that much value if you're going through all of these steps to fraudulently access one 350 Rand transfer. It makes more sense if you're able to access a number of transfers. And that's what we saw with the 18-year-old ID scandal. The very, very low grant value in itself is a disincentive for people with decent means to try to defraud the system, to go through all of these steps in order to simply access 350 Rand. Is it legal or normal for the government to track bank accounts? I don't know about the legality of bank account surveillance in South Africa or around the world, but I would certainly say it's not normal, or it should not be normal. I think it's undue state surveillance. It's extremely invasive. And as Dr. Kidd pointed out, it is visited on those in the poorest deciles, and certainly not on the richest. Can you suggest a pathway for linking SRD to economic opportunities? I answered this in a way. The SRD provides economic opportunities by virtue of being a direct cash transfer. However, there is talk about linking SRD grant beneficiaries to what are called active labour market programs. So things like giving them visibility of available jobs. They might be able to access a database of job listings in their area. They might be linked to training opportunities. It's important that those aren't conditional. So it's important that SRD grant recipients aren't forced to undergo certain training opportunities or forced to demonstrate that they're searching for a job, because that introduces more barriers to access that would end up excluding the eligible for very little policy gain. It's been shown internationally that it doesn't work in order to improve employment outcomes. Okay, I think that's everything. Siyanda, back to you.
Okay, thank you very much.
Could I just add a point or two in the comments that have been made?
Please.
Yes, sir, absolutely.
Yeah, I do think that one needs to highlight this rather important fact. We have to think about these issues around the issue of policy interlinkages and policy failures. The fact that the social grants are a permanent feature of our budget, it's because of failures in other policy areas. It's because of failure in education and training in the country. It's because of failures in employment creation in the country. There is work that I am still doing for the Department of Employment and Labor, sponsored by the European Union, it was shocking to analyze policy statements that South Africa has made since 1994 on employment creation. South Africa had a job summit under President Mandela, and I think also under President Mbeki. There was a growth and development summit there, and we've had 5 investment conferences in the country. There is this constant, continuing commitment to job creation. But when you look at the latest Statistics South Africa figures, going back to 1998 up to the current period, unemployment is continuously rising in South Africa. So we need to understand that social grants are not just there because we think they are the solution to South Africa's poverty problems. Social grants are required in South Africa because of the policy failures in other critical areas, in other critical policy areas. And the last point to mention, please, the idea of trying to link the SRD grant to economic opportunity is an oxymoron. It's contradictory. In the first place, you're giving people grants because they're unemployed. And when you then give them the grant, you then say, oh, let's show linkages to economic activity. It doesn't make sense. In the first instance, you're giving them the grant because they are unemployed. And you can't then say, oh, I'm going to give you the grant and then, you must go and do something that's going to make you become economically active. Why are you not doing those very same things before you even give them the grant? So we need to understand these interlinkages that are there, so that we understand this complex problem that we're having in the country. Thank you for the opportunity.
All right. Thank you, Dr. Wiseman. I wish we had more time because I think that a lot of people would love the discussion to continue, but we have to start wrapping up. So I'm going to invite the panelists just to offer very briefly any closing remarks, closing comments, starting with Dr. Stephen.
Yeah. Thanks for the opportunity just to say a few things. As I said, I think this really important study, put in an accessible format for international dissemination as well in South Africa would be really, really helpful. But I would like to say, around this discussion of universal basic income, etc. I think while nobody wants people to be living on poverty benefits and welfare and just that all of their lives, there's nothing incompatible between being in employment and also receiving a benefit. There's not a problem. You just tax it back through the job. You're paying for it itself, but that's a way of guaranteeing that everybody gets it. And I think it's critically important, and research has shown this also in South Africa, that giving, as Kelle said, by giving people a basic guarantee of an income, they're more likely to take risks and more likely to invest in higher return activities, more likely and more able to go and look for jobs. So you need to kind of see the compatibility of both. It's not all employment, it's not employment or a benefit. You can have both together and they can work together, and all the things can be fixed through the tax system, so that the better off you just tax the money back from them.
Thank you, Dr. Stephen. Kgotatso, still here.
Thank you so much, Siyanda. And yes, very insightful research study. I think Dr. Stephen just took the point out of my mouth. In 2002, it was recommended that South Africa needs a basic income grant. And I think the time is now. We've seen with the exclusion that the research has highlighted that we really cannot afford a grant at this with the current system. So the universal basic income grant is the way to go. Thank you.
Thank you, Kgotatso. Dr. Wiseman.
No, just very briefly, it is indeed very interesting what this research tells us if you consider the kind of constitution that we have in this country. It is very odd that in South Africa, with our social and political history, access to a social right that's guaranteed in the constitution should depend on owning or having access to a smartphone. There are very serious contradictions in that regard. No, thank you very much.
Thank you. Dr. Kelle?
I just want to say thank you so much to everybody for attending and to our panelists who've provided incredible insights and really helped to contextualize this research in terms of the international context of poverty targeting and exclusion, in terms of the experiences of beneficiaries and those looking to help them, and in terms of the constitutional imperatives in South Africa and the broader policy landscape. So thank you so much. I've actually, in the chat, I've posted a link to a fact sheet that we produced, which is an accessible summary of the report. So I'd encourage everybody who's interested to read it and share it with their networks. And thank you again. And also thank you very much to AFD, the French Development Agency, for funding this research and for being for their incredible support, to Under David especially.
Thank you, Kelle, and thank you to everyone for joining us today. Just last bit of housekeeping, we'll be sending the webinar, a link to a YouTube upload of this webinar tomorrow, as well as the other documents. And thank you, everyone, and I hope we'll see you in the next installment of the Economic Justice Matters fact sheet. Have a good day.
Thank you.